In this video, we will demonstrate some of the more advanced time and effort-saving features available in the OnePAC's Report Navigator system. In previous videos, we demonstrated how to generate a report simply by dictating findings exactly as the radiologist would wish them appear verbatim in the report, and then inserting those findings into report templates. In this video, we will demonstrate how to leverage some of the built-in reporting features of the Navigator system such that the radiologist will not have to dictate full sentences regarding common findings. In this example, the radiologist is dictating a chest X-ray examination regarding PICC line placement. The study type is chest X-ray as indicated in the upper left-hand corner of the reporting window. The radiologist first notes that there is a left-sided PICC line in place with its tip overlying the superior vena cava. As the radiologist does not wish to dictate a full sentence regarding this, which is more time-consuming than necessary, the radiologist simply records the information that they wish to insert into the report by dictating left PICC SVC. Additionally, the radiologist handles a finding regarding left lower lobe opacity, which is felt to possibly reflect atelectasis or pneumonia, by simply dictating hazy left lower lobe atelectasis or pneumonia. Next, the radiologist notes that the patient is status post right-sided rotator cuff surgery. The radiologist dictates a verbatim sentence regarding this finding that the radiologist will insert into the report, and additionally states impression at the end of this line to ensure that it will be routed into the findings and impression sections. Finally, the radiologist dictates a statement regarding right upper quadrant cholecystectomy clips. At the end of this sentence, the radiologist dictates no impression, as the radiologist does not wish this to be inserted into the impression section. This completes the dictation and the radiologist launches the Report Navigator system. The radiologist is initially presented with a report template regarding chest X-rays. This is the radiologist's default template for chest X-ray examinations. Default templates can be defined for individual users or radiology groups, and if none such are defined, system-wide default templates will be applied. In this case, the radiologist is dictating a PICC line placement, and as the radiologist dictates many of these, the radiologist subscribes to a template regarding PICC lines that will facilitate reporting of PICC lines with minimal effort. The radiologist's dictation is inserted into the study findings section. With regards to the first statement of a left-sided PICC line, there is already a OnePAC's Report Navigator predefined phrase regarding PICC lines that exists in the findings section. We can see that phrase in both the findings section and in slightly different form in the impression section. The impression form is usually somewhat more abbreviated. In this case, the radiologist needs to change right to left as the PICC line is on the left side. If the PICC line were not overlying the superior vena cava, the radiologist could click on the location to change the location to a number of predefined locations. Note that the change that the radiologist makes in the phrase in this location will apply both to the findings as well as the impression sections. Next, the radiologist wishes to describe hazy left lower lobe atelectasis or pneumonia. Again, interacting with predefined phrases, the radiologist simply changes the clear lungs phrase to a phrase regarding pulmonary opacity. The radiologist simply sets the characteristics of the opacity to match those which belong in this report. And the findings are inserted into both the findings and impression section. Next, the radiologist wishes to insert statements regarding rotator cuff surgery and cholecystectomy clips, the first going into both findings and impression sections, and the second going only into the findings section. The radiologist inserts each of these statements. The report is now in final form and may be transferred to OnePAC's or to other PACS systems.